In this video, we are going to talk about CPT code 99202. Now, this code is going to be for a new patient. It's very straightforward. It is a low medical decision type of appointment. So to meet this level, documentation must show that there is one self-limited or very minor problem, that there is minimal or no data that's needed to be reviewed, and you're not going to order any labs or anything like that or collaborate with another provider. And then there's minimal risk of complications or treatment. So let's take a look of an example of what would meet a 99202. So, of course, the chief complaint would be something where someone comes in for a very minor issue. For example, an evaluation of seasonal allergies. So if we look at the history, the patient comes in, they report that they've had a runny nose, they're sneezing, and their eyes are very itchy. This has been happening for about a week. And there's no fever, there's no chest congestion, their lungs are clear, no wheezing. And they tell you that all this happens every year during the spring. And they just take over-the-counter medication and they get some relief, but they just wanted to come in and get checked out. So the nursing assistant or medical assistant does their vitals, and all the vitals are stable. They're not taking any medication except for this over-the-counter medication for seasonal allergies. Their nasal mucosa is slightly edematous, but nothing to warrant any issues. There's no sign of infection whatsoever. So when we get to our assessment and plan, we know that we're going to diagnose this patient with allergic rhinitis, right? And it's uncomplicated. The plan is just to continue what they've been doing, over-the-counter medication. You may want to add like a nasal saline spray to help as well. You're going to educate them to avoid whatever is triggering, if they can, this allergen, and to follow up as needed. We don't really need to schedule a follow-up appointment for this. There's no labs, there's no imaging, there's no consults ordered. No prescription medications have been written, and there's no significant comorbidities or risk whatsoever. So when you look at this, the problem that we addressed was allergic rhinitis or seasonal allergies, and the data, there wasn't really any data to review, nothing to order, and there were minimal risk. And we didn't write any prescriptions. So in summary, this visit is appropriate for a 99202 because it is minor, there is no data reviewed, there's minimal risk, and it is a new patient, and it's very straightforward. So this is criteria for 99202.